So I'd like to now introduce you to Dr. Michelle Keller. Michelle is a senior manager of scientific business development at Deep Longevity, an artificial intelligence company that develops and utilizes deep learning systems for aging and longevity research, and a pioneer in deep biomarkers of aging. Michelle is the driver behind finding reliable ways to translate scientific theory into real-world practice, and she works very hard to bring together insurance companies and clinics together to increase customer longevity. I'm really excited to hear more about this cutting-edge field of health. So over to you, Michelle. Thank you.
Hello, everyone. So thank you for your introduction and good morning. My name is Michelle and I work as a senior manager of scientific business development at Deep Longevity. We are a startup aiming at extending healthy human lifespan, utilizing state-of-the-art technologies and science. And before I begin, I would like to say a special thank you to the Science and Technology Facilities Council and the International Women in Science for organizing this event with a focus on female scientific community. I'm greatly honored to have a chance to speak together with those extraordinary fellow ladies out here. And I think it's extremely important to bridge the gender gap in STEM fields and to make sure our voices are heard and our opinions are recognized and respected. So today I'll be talking about how clinical practice is transformed and empowered by artificial intelligence and how this can help us achieve the healthy human longevity for everyone. So let's get started. The next slide, please. First, I'd like to tell you a few words about myself. I specialize in bioinformatics, and I've started my career at Insilica Medicine, a leader in the field of next-generation AI solutions for drug discovery. So nearly a year and a half ago, Insilica announced a spin-off, Deep Longevity, which focuses on longevity extension. And that's when I chose to focus on biomarker development and joined this company. But over time, my range of expertise has broadened and evolved, specifically in the process of establishing a new branch within the company, which is actually called scientific business development. So inside this branch, we aim at translating scientific research into real-world practice. And nowadays, my job as a senior manager of this branch is to build and maintain the relationships with clinics and insurance companies, because we are striving to establish an integrated health ecosystem. And every project, every product under my supervision is just another step towards what we call LAS, or longevity as a service. So let's get to the next slide. First, I'll briefly mention the key notions which are needed to understand what I'm trying to say about the whole field of biomarkers and aging clocks. So what exactly is a biological age? The biological age is age determined by physiology rather than time, in contrast to what we know as a chronological age. So we can think of a biological age as another way to estimate health status of a person in the context of aging. And this slide specifically focuses on aging clocks. And the aging clock means a computational model or an algorithm which can predict the biological age of a person based on some kind of data. And it's essential to understand that data is the heart of this technology. So the data can range from simple questionnaires to medical data, ECG, EEG records, to even high throughput sequencing and molecular data. And as pioneers in deep aging clock industry, we focus on training deep neural networks to predict biological age. This approach enables not only having just some neural network, just some predictive tool, but also we have worked out a way to actually look inside this black box and see what's inside. So we have an opportunity to analyze what aspects of data turned out to be the most important for the biological age prediction. And this is actually how we are getting closer to assess the whole causality model of the aging process, while identifying the key drivers of aging. The next slide, please. But from the biological perspective, we should always keep in mind, and we should all be aware that aging is a complex multifactorial process, which can trigger changes on every level, from individual molecular events to cell and tissue reorganization, which can ultimately lead to shifts in the whole organ system and the body. So this needs to be specifically accounted for in our technology. So that's why we've developed an age metric. You can see a colorful circle on the right side of the slide. So this is how we represent age metric. So it actually is an integrative estimate of the biological age, which we derive from different sources of data. So this age metric approach helps us create a full holistic view on the process of aging while taking influences of different modalities of this aging process into account. The next slide. So what do we include to our age metric? Since 2015 or 2016, the scientists of deep longevity have gone from single deep aging clock to developing a diverse portfolio, which is depicted on the slide. So every circle here depicts an individual deep neural network, which can predict the biological age based on some kind of data. And as these deep clocks get integrated into clinical real-world practice, hospitals, insurance companies, they actually find these tools valuable because they offer cost-effective medical care in addition to being able to obtain even more value for the same amount of financial investment. So I decided to focus today on the blood aging clock, or here on the slide, it says deep hematological aging clocks, because this has a direct way of being implemented into the real world practice. So the next slide. Deep neural networks, as we see, are able to capture highly nonlinear dependencies between changes in blood markers levels and aging. And what we see here on the image is a population distribution of the actual age versus predicted age. So we see that the neural network definitely captures the trend, and we can divide the whole population. We can divide the whole population into two groups: those with aging rate higher and slower than 1 year per year. So the concept of aging rate is quite simple. If someone is said to have an aging rate of 0.5 years, it means that every year this person gains only 0.5 years. So they are aging very, very slow. And in 10 years, they will be biologically older only by 5 years. So this is how we visualize the accuracy of our aging clocks. And what about the biological relevance? So how do we explain why our neural networks actually output something which is biologically relevant? Let's move to the next slide. So what I was talking about when I mentioned looking actually inside the black box is this concept of feature importance analysis. And we were able to identify the key aging or rejuvenation drivers between the markers from our model. And for every marker listed on the slide, we can actually have a scientific backup for the claim that this marker is extremely important for aging. So that ensures that our biological age model, in this case, is reflecting biological reality. The next slide. Yeah, and I think the most important thing behind the concept of aging clocks, that if we think about the biological age, what properties should it have? The main property is the biological age should be more predictive of mortality than the chronological age is. Again, because biological age means that we are trying to reflect mortality. And it actually happens that our biological blood age model is able to capture the differences in the possibility of death over time. That means that if the neural network sees you as a person who is 5 years older than actual age, then you are indeed aging faster. So your hazard ratio, your probability of death is higher than that of a person who is predicted like 5 years younger than their chronological age. So this is just another proof of our neural networks capturing biological reality. The next slide. And so I was talking about the technology, the concept, and how does it actually comes to life. Longevity medicine is a branch of precision medicine targeted on promoting health span, lifespan, and is powered by AI technology. And it is a burgeoning, rapidly evolving discipline, and it is fueled by progress in neurosciences, AI, biotechnology, and clinical medicine. And what is important is that longevity medicine continuously adds the most advanced personalized approaches, such as listed on the slide. And as you see, one of these approaches is deep aging biomarkers or deep aging clocks. So the enormous pace and granularity of the research demands an intensive acceleration of the translation from basic science towards the clinic and continued credible education for practicing physicians. So the question is how this can be achieved. The next slide, please. At Deep Longevity, we've developed a system which enabled close interaction with both physicians and their patients to track aging and to even reverse it. So we generally deployed two solutions, the application and an in-depth PDF report stating the biological age of a person. So aging clocks are computational models, which means that we can run simulations while tweaking the blood parameters a bit and see what actually can lead us to rejuvenation. So if we run a lot of these simulations, we can actually construct a path which can make the person younger. And we combine those simulations, those in silico simulations, with our recommendation engine, which can generate the non-branded recommendations, and they are available for users in our app and in our reports. So what we do is we recommend the specific steps which are to follow if the person wants to get younger. And the progress in longevity medicine is could not be real without physicians. So it can move, this progress can move only as fast as the physicians do. So we are focusing on bridging the gap between healthcare providers and interdisciplinary experts. So Deep Longevity has released a course which got CME accreditation, and we are trying to improve healthcare system and trying to communicate to physicians the benefits, the key notions of longevity science. That's what we're talking about previously. Yeah, our role is being able to translate some scientific advances into something which can be practically applicable and reachable. And to do that, we need to engage physicians more and more. And this requires constant communication and attempts to give them some extra scientific credibility and educational opportunities. The next slide, please. So the next slide, please. Thank you. So as a young female scientist, I can honestly say that my job is a constant battle. At least this is how I feel on a daily basis. And I need a strong voice to be heard and to be respected by my colleagues, my clients, my competitors. And I guess everyone here can relate. And you could say that being valued for your accomplishments is how it always works. So you have to fight for that. But what I think is essential to mention is that women should not ever be put in a position where they have to work or fight more than their male colleagues to reach the same level of respect. So with this in mind, I encourage all of you to value your achievements and continue to be bold, be heard, be seen. And thank you.
Thank you very much, Michelle. That's fantastic. I definitely echo a lot of your sentiments around, being on the same equal footing. So yes, this is definitely about being bold and being seen and being heard. Thank you. We do have a couple of questions on your fascinating talk. It's a whole new era to see this type of research being undertaken. I mean, one of the questions that I had was really, when you say that you can halt or become younger through this type of process, is it halting the aging process so that you then build health, or can you genuinely take or improve your health so that you're taking effectively years off yourself? Like, how does that work in practice?
Okay, that's a great question, actually. And what needs to be mentioned here is that what do we mean by making someone younger or extending longevity? We mean that we want not to extend the longevity like 80 plus years, the probability of you having a serious deadly disease, it continuously grows and grows, and you do not feel well most of the time. This is not what we are striving for. And this misconception actually leads a lot of people to resist the desire to live longer, because what everyone focuses on is that we do not want to be old. Yeah, we want to be young. And we do not to live long, because if we live long, then we will be older for a longer time. But actually, what do we mean is that we want to focus on extending the period of your peak performance throughout life. That's why all our tools, they are trying to reflect your biological reality and your health status. And in our concept, youth and health, they are practically the same, with the change, with the difference that youth for us is not only being healthy, but being on your best performance level. That's what I'll say.
Okay, thank you. And how does that work? Is it a shared program? So the insurance companies, you talk about insurance and the clinicians. So as a patient, would I go in and work with a clinician, or would I work with a team of people, including those from Deep Longevity, who would keep monitoring my performance over time?
So our model currently is that we are trying to communicate all the details to the physicians to explain how our tools work, provide them with the most user-friendly and medicine-oriented reports, and then they are to communicate the message to their clients. So in this situation, we are focusing on physicians mostly. So you as a client, you will attend your physician, take a consultation, and receive the recommendation on your lifestyle change or supplementation or something else, empowered by AI from Deep Longevity and backed up by our longevity discourse that we create together with physicians.
Okay, so it's a fascinating model, actually. And it's quite supportive as well when you look at it from that aspect. I do have a couple of questions here. We wanted to see where have you seen the biggest impact from longevity research Have you seen impact on it? I mean, I understand it's a new cutting edge technology, but are you able to see how it's impacting and monitoring some of the outcomes?
I guess the most fascinating thing about this technology is accelerating the pace of applying therapeutic interventions in clinical practice. What do I mean by this? Our aging clocks, they can be used as a cheap and fast way to go through like in silico clinical trials, because we can measure the effect of any intervention, be it supplementation or some lifestyle modification. We can measure its effectiveness in terms, how much younger does it make myself? So what is my gain in terms of these quality adjusted life years? What do I gain? And this concept of validating therapies via aging clocks is something which I admire it.
Yes, I do. I am fascinated by it. And I'm interested to hear that you use QALY, so quality adjusted life years. It's a measure that we use very heavily in healthcare, particularly around assessing the value of a medicine. So also it's almost a translation of that model, which is interesting to see. Another question that's come up was around your modeling showed that you looked at longevity in different populations. So I think it was Canada, South Korea, and Europe. Has this been done in these populations, and does this take into account the different cultures, the lifestyles, the diets, etc.? And are you seeing a difference in longevity within these different populations?
Yeah, actually, this project was a very important one in our understanding of how aging is reflected across different cultures and different populations. So we noticed that our aging clocks, our original version, it works slightly better on some cultures because they were represented more in our training data set. And we identified the populations which performed not so well for our aging clocks. And we tried not to hide it and decided to deal with it and to, in parallel, to understand what drives those differences and those changes. And what we have accomplished is that we've created a model which takes the population into account and thus becomes a universal model. So we try to compare different aging clocks, which were like population specific. And when you include everyone, the aging clocks actually work better in all circumstances. So I think it was a very interesting project of ours. So something about cultural diversity is actually very important, even in our neural networks.
It is very interesting to see, actually. And I'm interested, we've had a question come in on the chats to say, have you had any resistance from the idea that you are interfering with the natural process? And just tying into that, does it differ between cultures as well then?
Oh, sorry, could you please repeat?
Sure. The question was, have you had any resistance from the idea that you are interfering with the natural aging process? So with this AI process of longevity, is there any kickback or resistance to the work that you do?
Yeah, this field is full of controversy, and there are like radical opposing views on longevity and aging prevention. And I think I can also mention one of our other projects, which aims at assessing the psychological status of a person. So we actually developed something we like to call mind age.
Right.
So it is based on a psychological questionnaire, like few questions, not 200, like in some clinical practices. And what was the most striking insight from the psychological data is that longevity optimism, so the optimistic outlook on the future and being engaged in the process of rejuvenation and knowing more about longevity field, it actually makes a person psychologically younger. So it is like feel younger and live longer. And for me, it was like a revelation. If you focus on your longevity and you feel optimistic about it, it actually changes your life. And this is my answer to those who are opposed to the idea. I think that we just need to share more on this paradigm and explain that what we are trying to gain are quality adjusted life years. It's your peak performance time. It's not like it's not like living 100-year-old and feel like 100-year-old. No, completely different thing. And what we are trying to do in this regard is to spread the knowledge and share our view on longevity.
Thank you. I'm with you on this. I think longevity goes hand in hand with good health. So I think it's a fascinating process, and I'm hoping that it will come out. More and more people will see that point of view and take it on board. Yeah. Thank you. And our last and final question that we will be asking all our speakers is, what took you on this journey, Michelle? How did you get involved with the longevity process, and what inspired for you?
So I think what influenced me the most is my education, which was a faculty of bioengineering and bioinformatics. And the research on this faculty was primarily focused on the apoptosis, on aging, and prevention of aging. And when you collaborate with the longevity enthusiast day to day, it's inevitable that you will energize and like absorb this idea into the back of your head. and then when you see the opportunity to contribute to aging biomarker research, I could not resist. It was the most interesting thing for me to do, and I like what I do.
And which is brilliant. And so it's interesting to see that it is really just exposure. It is being able to see that these things are out there, hearing about them, meeting the people, and letting that energy become infectious. Yeah. Thank you so much.